What causes systemic vascular resistance to decrease in septic shock? Vasodilation due to the release of cytokines such as histamines, bradykinin, and prostaglandins leads to decreased systemic vascular resistance in septic shock. How does septic shock affect cardiac output and mixed venous oxygen saturation? Cardiac output increases, and mixed venous oxygen saturation rises due to enhanced tissue perfusion and reduced oxygen extraction. What happens to left and right atrial pressures during septic shock? Both pulmonary capillary wedge pressure, left atrial pressure, and central venous pressure, right atrial pressure, decrease in septic shock. What is the formula relating cardiac output to oxygen delivery and content? Cardiac output equals oxygen delivery divided by oxygen content of arteries, oxygen content of veins. In septic shock, how does the oxygen content of venous blood change? The oxygen content of venous blood increases because tissues extract less oxygen due to hyperdynamic circulation. What are the hemodynamic characteristics of septic shock? Decreased systemic vascular resistance, decreased afterload, increased cardiac output, increased mixed venous oxygen saturation, decreased pulmonary capillary wedge pressure, increased ejection fraction, and decreased central venous pressure. What criteria define systemic inflammatory response syndrome, sirs? 2 or more of the following: temperature below 36 degrees Celsius or above 38 degrees Celsius, heart rate over 90 beats per minute, respiratory rate over 20 breaths per minute, partial arterial carbon dioxide pressure less than 32 millimeters of mercury, white blood cell count above 12,000/mm superscript 3 or below 4,000/mm superscript 3. What additional findings indicate severe sepsis? Evidence of infection, e.g., dirty cerebrospinal fluid, dirty urine, pulmonary infiltrate, lactic acidosis, hypotension, elevated liver function tests, and elevated creatinine levels. What are the components of the Quick Sequential Organ Failure Assessment (QSOFA) score for septic shock? Altered mental status, respiratory rate of 22 breaths per minute or higher, and systolic blood pressure of 100 millimeters of mercury or lower. How is septic shock initially treated? Administration of broad-spectrum antibiotics covering Pseudomonas and methicillin-resistant Staphylococcus aureus, such as ceftazidime and vancomycin, along with intravenous fluids to increase mean arterial pressure. If a patient in septic shock does not respond to intravenous fluids, what is the next step? Administer vasopressors like norepinephrine to raise systemic vascular resistance and improve blood pressure. In general, how does systemic vascular resistance and cardiac output relate in different types of shock? They typically oppose each other. When one increases, the other decreases, except in neurogenic shock where both decrease. What causes the decrease in systemic vascular resistance and cardiac output in neurogenic shock? Loss of sympathetic nervous system tone due to spinal cord injury leads to vasodilation and reduced cardiac contractility. Why does bradycardia occur in neurogenic shock? The lack of sympathetic stimulation and unopposed parasympathetic, vagal, activity result in a slower heart rate. What are common causes of neurogenic shock? Spinal cord injury, spinal surgery complications, spinal abscesses in intravenous drug users, and epidural anesthesia complications. How does cardiogenic shock affect cardiac output and systemic vascular resistance? Cardiac output decreases due to impaired heart function, and systemic vascular resistance increases as a compensatory mechanism. What happens to atrial pressures and mixed venous oxygen saturation in cardiogenic shock? Both left and right atrial pressures increase due to blood backing up, and mixed venous oxygen saturation decreases because tissues extract more oxygen. How is cardiogenic shock treated? Use positive inotropic agents like digoxin, beta-1 adrenergic agonists, or phosphodiesterase inhibitors like milrinone to improve cardiac contractility. What effect does milrinone have on hemodynamics in cardiogenic shock? Milrinone increases cardiac output by raising cyclic AMP levels in cardiac myocytes, leading to a wider pulse pressure due to higher systolic blood pressure and decreased systemic vascular resistance. What are the hemodynamic characteristics of cardiogenic shock? Increased systemic vascular resistance, increased afterload, decreased cardiac output, decreased mixed venous oxygen saturation, increased pulmonary capillary wedge pressure, decreased ejection fraction, and increased central venous pressure. How does hypovolemic shock affect preload and cardiac output? Preload decreases due to reduced blood volume, leading to a decrease in cardiac output. What happens to systemic vascular resistance in hypovolemic shock? Systemic vascular resistance increases as the body attempts to maintain blood pressure by vasoconstriction. How are atrial pressures affected in hypovolemic shock? Both pulmonary capillary wedge pressure and central venous pressure decrease due to the lack of circulating volume. How is hypovolemic shock treated? Administration of intravenous fluids, typically normal saline, to restore circulating volume. How can you differentiate between hypovolemic and cardiogenic shock based on atrial pressures? In hypovolemic shock, both right and left atrial pressures are low due to decreased volume, whereas in cardiogenic shock, both pressures are high because of blood backing up in the heart. What are the hemodynamic characteristics of hypovolemic shock? Increased systemic vascular resistance, decreased preload, decreased cardiac output, decreased mixed venous oxygen saturation, decreased pulmonary capillary wedge pressure, decreased ejection fraction, and decreased central venous pressure.